Welcome back. Today we are talking about an often very painful chronic condition affecting millions of women around the world, and it can lead to all sorts of other complications like infertility. Today we're talking about endometriosis, and the month of March is actually Awareness for Endo. Joining me today is Dr. Olga Muldoon, a gynecologic surgeon at Advent Health Porter. Thank you for coming in today.
Thank you so much for having me.
This is a tricky one. This is a hard one even to diagnose, isn't it?
It's very tricky. It's very sad. The average time to diagnosis can be up to 7 to 10 years for the average patient. So years for a patient to get a diagnosis and understand what's going on with their body.
So before we even get into the diving at the depths of endo, like what is this thing? There's a primary organ affected, but just give us like the Reader's Digest version of what is this?
Yeah, so endometriosis is where you can find endometrial glands and stroma outside of the uterus. It's actually inside of the abdominal cavity, inside of the pelvis, on the cervix, on the bladder, on the fallopian tubes, ovaries, sometimes even the diaphragm. We've even found it on the other side of the diaphragm in the actual lung cavity.
That sounds terrible. It's also kind of wild that that's that hard to diagnose.
So hard. Imaging can miss it the majority of the time, and so that's why it can take so long for patients to get a diagnosis.
So typical symptoms mirror other things, right? Painful
Definitely.
periods, but what else? Like what gives you a clue as a doctor, like, we've ruled out the basics, something's going on here?
Well, so first I would say painful periods, but if you're noticing that your activities of daily living are super impacted by it, that's already an 80% predictive index for you having endometriosis.
Like periods should not be debilitating.
It should not in any way. And I see patients who convince themselves out of having endometriosis because they're like, maybe I'm just not tough enough. If I only have pain for a couple days, maybe that means I don't have it. But the truth is they always had it. There are actually studies showing that you can have stem cells in fetuses that show endometriosis. So this isn't their fault. They didn't do this to themselves. This is something they had from birth.
This feels like one of those things that when you finally click into what's going on, you must see patients that are like, somebody's listening. Somebody gets it, finally, right? Is it one of those?
Totally. I think the hardest cases for me are when I see patients who are crying after having surgery or having a diagnosis because they've spent years, decades in pain without any real diagnosis. And that includes for some with atypical symptoms like infertility, as well as bowel symptoms. For those patients, this is a lifesaver.
Let's talk about fertility. Actually, let's talk about fertility in a second. First, let's talk about how you can fix this, because you can have a surgery that can help with this, right? That's what you do.
Yes. So there are numerous ways to address endometriosis. It depends on the patient's goals of care, but surgery is one of them. And I perform excisional surgery where I take out the endometriosis with the goal of improving symptoms. That may include fertility, that may include their actual pain. It depends on what those symptoms are, but there are options.
Fertility is one of the big impacts here. Women are really having a hard time having babies if they're dealing with this, if they're in the baby years, right?
Yes, so the research says that anywhere from 4 in 10 to 8 in 10 women who have unexplained infertility, it's because of endometriosis. I mean, that's an astounding number to me that all of these women who have unexplained infertility don't know that they have endo.
And it's something that you can potentially fix. So you might be able to help your fertility.
Certainly.
You don't just have no option here.
Exactly, but I also think just the validation of understanding what went wrong, why was infertility happening all this time, is so empowering for women.
Yeah, wow, okay, that's pretty wild. So I guess if you could give advice to a patient, women of a certain age perhaps, like, okay, something's going on here, what are the questions, what do I need to look for, and what are the questions or prompts I give my doctor? What would that be?
Yeah, I mean, I think certainly if you're having pain with periods, painful intercourse, sometimes bowel symptoms like alternating diarrhea, constipation, infertility, those are some of the things that really make me start to think that you should be evaluated for endometriosis. And then when you go see your doctor, I've had patients feel dismissed. If you're feeling dismissed, then it's time to go see yet another doctor, right? It's time to really make sure that somebody is investing in this process with you and ensuring that this has been thoroughly looked at. Questions include, is it normal for me to have these symptoms? And also, do you think it might be endometriosis? I think a point-blank question often allows that physician to think through whether this is happening.
There's a lot of talk around patient advocacy now and like advocate for yourself to ask more questions, like the dismissal idea. People get really, they're kind of over that now.
Yeah.
I know that can be tough for doctors if you're dealing with a very difficult, challenging patient, but I think that's so fascinating. This is one of those things where it's like, no, ask those questions.
Definitely.
Ask them.
And I always say, I think those pointed, directed questions force the patient to ask, are you the very best person at this?
Yeah.
And if you feel like you don't know enough about this, is there someone in town who specializes in this, who does this all day, every day? Can I just talk to that person? Is that okay? I think that's when patients find me, they're like, I've been waiting to talk to you for quite a while. And for me, it's a wonderful moment, but I have those moments too, where sometimes I'm like, this specific scenario isn't actually what I'm best at. Let's send you to the best that I can find.
Yeah, okay. Well, thank you, Dr. Muldoon. Thanks for coming in, walking us through this, and hopefully we can give some folks some good info and help them help themselves a little bit, right?
Yeah, thank you so much for having me. I really appreciate it.
All right, we're